basically helpless. You feel like in his passing, you're still failing him over and above everything else. All they said was the doctors that's doing the autopsy are on strike. But having said that, they promised us, even prior to them being on strike, the Monday and today, we were supposed to have him in our hands Friday last week already. And we nowhere closer to closure, honestly speaking. Going through this experience, I've lost faith already, to be quite honest. If we do by any chance, or anyone comes out and helps, it will be a miracle, to be quite honest with you.
So what we've been told is that the doctors here are overworked. So that's the most that we've got from the staff. I mean, our body in particular was here last week, Monday. You know, it's a week later and we still don't have the body, but the only thing that the staff is saying is that the guys are overworked here. I mean, you can imagine, right? The people are traumatized. Already, the fact that you've lost your loved one due to unnatural circumstances, be it murder, suicide, or whatever, so they're already traumatized. Now you've already made the funeral arrangements to get your family member buried, and now you can't do that because of what's happening at the government mortuary.
Our service, it is a similar service to the one that is rendered, let's say, by the birth care laboratories, where a doctor will refer a specimen or a patient to the lab to get whatever test that needs to be done. Once the results or the tests are conducted, the result will be taken back to the referring doctor, who will in turn inform the patient. So that is the same situation with us. We don't just grab the bodies, but those bodies are referred to us by the police for the purpose of their investigation, of which they will indicate what type of investigations they want us to undertake. Some, they can be done or concluded within a day. Some, they might take more than 7 days. Some might take more than a month or even up to 24 months to conclude. But what is important is, as a department, we said at least within 72 hours, if a body is admitted to us, we must be able to make sure that after 72 hours, the investigations are conducted so that the bodies can be released. But I think there is a gap that we need to close between ourselves and the police and the families, so that the police, when they refer the bodies to us, they must inform the families to say, allow 72 hours before you can start preparing for the funerals. It's the gap that I think we need to address as a matter of urgency between the Department of Health and the South African Police Service.